Hello students, today I'll be teaching you viral diseases of oral cavity. We'll be covering this chapter under two headings, part 1 and part 2. Now, if we classify the viral infections, they can be classified as herpes simplex virus infection, varicella zoster virus infection, hand, foot, and mouth disease, herpangina, measles, viral hepatitis, and HIV. In part 1, I'll be covering till herpangina. Now, first we start with the herpes simplex virus infection. There are 80 known herpes viruses, and 8 of them are known to cause infections in humans. Important ones are HSV 1 and 2, Varicella zoster, cytomegalo, Epstein-Barr virus, and HHV 6, 7, and 8. All the herpes viruses have a DNA and can remain latent in the host neural cells, thereby invading the host response. Now, this is the basic reason that why they reoccur in a person always. HHV1 is known as herpes simplex type 1. It causes the primary infection of herpetic gingivostomatitis or oral herpes. In some hosts, it becomes latent and may periodically reoccur as a common cold sore or recurrent herpes labialis. HHV2, it causes genital lesions known as genital herpes and occasionally causes oral diseases that is clinically similar to the HHV1. HHV3 is a zoster or the shingles or the chicken pox. It causes the primary infection of chicken pox in children and zoster in the adults. HHV4 is Epstein-Barr virus, causes the primary infectious mononucleosis. HHV4 causes a frequent Burkitt's lymphoma. HHV5 is a cytomegalovirus type. HHV6 causes acute infection of the CD4 and T lymphocytes known as roseola infantum. It is a type of a febrile illness that affects the young children. HHV7 is just like a roseola infantum infection, but along with it is accompanied with febrile seizures in the children. HHV8 virus is known as Kaposi sarcoma virus, which is being linked with many of the syndromes, Castleman disease, and lymphomas. If we go back to the pathogenesis, there is a physical contact with the infected individual to cause the herpes simplex virus infection. It is being the typical route for HSV inoculation for a seronegative individual who has been previously not exposed to virus. The virus binds to the cell surface epithelium via heparan sulfate, followed by sequential activation of the specific genes during the lytic phase of the infection. There are varied clinical forms, acute herpetic gingivostomatitis, as you can see in the clinical pic. It is being bleedy gingiva and vesicles are present all over the attached gingival region. It leads to gingivostomatitis, pharyngotonsillitis, vesicle appear on the all intraoral mucosal surfaces, buccal mucosa, hard palate, soft palate, floor of mouth, gingiva, tonsillar pillars and pharynx. The vesicles are thin-walled, are surrounded by inflammatory waves. Important diagnostic criteria is there is a generalized acute marginal gingivitis. The vesicles quickly rupture, leave behind a shallow, round, small, painful ulcer, and as the disease progresses, they coalesce to form a larger defect. Herpetic meningoencephalitis, it is characterized by sudden fever and leading to increased intracranial pressure. Keratoconjunctivitis means swelling and congestion of the palpebral conjunctiva. Eczema means there is a vesicular eruptions on the skin. Of the newborn infections may be caused by direct contact of the vaginal HSV during birth. Then vitiligo, as you can see in the pic also, on the nail if the infection occurs of the herpes is herpetic vitiligo. Recurrent herpes labialis, as you can see on the lips, it is there, vermilion border adjacent to the lips. It is known as cold sore or the fever blister. What is the treatment? Treatment is acyclovir 400 mg, aspirin, IV fluids, and diclofenac HCl as a topical anesthetic we can give. Now coming on to zoster infection. The zoster infection is of two types, as I've already telling you, chickenpox and the shingles. If we look back to the chickenpox, the symptomatic phase of a chickenpox begins with a malaise, pharyngitis, rhinitis, headache, anorexia, and vomiting. It is a pruritic exanthem. The early lesion, as you can see on the pic also, it is being dewdrop on a rose petal. The rash begins on the face, then on the trunk, as you can see in the pic number 2, and each lesion progresses through erythema, vesicle, pustule, and a hardened crust. Third stage, oral lesion appear and are common and can precede the skin lesions. Lesions resemble primary HSV, but they can be distinguished as they are painless. Now, coming on to the next part, there are possible complications with the chickenpox in the children. Reye syndrome is there. Secondary skin infections may occur of the fungus. Cerebral ataxia, pneumonia may occur. GIT disturbances may occur in a patient. So, infection during pregnancy can cause neonatal chickenpox. It can also result in abortions and congenital effects. Infection in immunocompromised individual can be many severe, like they cause pneumonia, pancreatitis, and encephalitis. Now, zoster. Zoster is an adult. After initial infection of Varicella zoster, the virus is transported to the sensory nerve ganglia. Clinically evident herpes zoster can occur after reactivation of the virus. On skin, within 3 to 4 days, the vesicle become pustule, as you can see in the first pic. In the second pic, it will ulcerate. But always remember, it will cover only the half side of the body which is being affected. So clinical features starting with zoster is first pain is there in a patient in this active ganglionitis develops with resultant neuronal necrosis and severe neuralgia. 10% of the individual will have only no prodromal pain, otherwise 90% cases have pain prior to zoster. Then severe pain after that, zoster will appear without a rash. Then we have involved skin develops cluster of vesicles, see in the pic number 3, and they tend to follow the path of affected nerves. In the next stage, oral lesions occur when trigeminal nerve is involved. Then in the next, involvement of the maxilla also occur. Ocular infections, see the pic number next. Ramsay-Hunt syndrome. Pain and vesicles appear in the external auditory canal. Patient loses a taste sensation from anterior two-third of the tongue with ipsilateral facial palsy, and the facial nerve is being involved here. Chronic phases, see the pic here. Many patients do not progress to this stage, but here now neuralgia is there. 50% of patients will have neuralgia. If the pain is described by burning, throbbing, aching, itching, even after the 3 months of the rash, it is neuralgia. Treatment for all. For chickenpox, there is a vaccination. For zoster in an adult, there is antiviral therapy. Acyclovir is given in a higher dosage of 800 milligram 5 times a day for 7 to 10 days. Now next is Coxsackie virus. They causes herpangina or acute lymphanodal pharyngitis. Hand, foot and mouth disease is also caused by Coxsackie viruses. First is herpangina. Herpangina is caused by group A. Has been reported to be sporadic in outbreaks, mostly seen in younger children, and adults are more oftenly not affected. Now see the clinical pics, you will never forget. It begins as a sore throat. Why sore throat? Because the vesicles appear in the pharyngotonsillar region. Low grade fever, headache, vomiting and abdominal pain. Therapy for patient is directed only towards a symptomatic relief. It will be okay within 1 week. Enterovirus or the hand, foot and mouth disease. Like herpangina, there is a hand, foot and mouth disease also. It causes flu-like symptoms. The name fairly well describes the location of lesions. Oral lesions are those on hands. The oral lesions arise without prodromal symptoms also. If we go to the enterovirus family, here look onto the number 4, Echococcus A. It causes infection on the skin as well as oral mucous membrane. So the disease is hand, foot and mouth disease of herpangina. Now here you can see on the hand the lesions are there, on the foot the lesions are there, and the oral cavity. The oral lesions resemble those of herpangina but may be more numerous and not confined to posterior area of the mouth. The cutaneous lesions range from few to dozens and primarily affect border of palms, soles and ventral surfaces and side of fingers and toes are affected. So the treatment is supportive only, no as such treatment is not being given. Thank you.